Welcome to another episode of Talking with Docs. I'm Dr. Brad Weening.
And I'm Dr. Paul Zalzal.
Today we're going to be talking about non-operative management of arthritis of the hip.
Yeah, arthritis of the hip is a very common condition, and not everybody with arthritis of the hip needs a hip replacement right away. So we wanted to just review some of the options you can use if you're too young to have a hip replacement or you're not in enough pain to have a hip replacement. And of course, please refer to our hip replacement video for details about that treatment.
So the main goals of non-operative management of hip arthritis are to reduce your pain and increase your mobility. And we do this by reducing the inflammation in the hip, increasing your range of motion, and improving the strength of the muscles that are around the hip.
Yeah, and the way we approach this is with a multimodal approach. I used to call this a shotgun approach, as I mentioned in our total knee replacement, our knee arthritis video. But yeah, that definitely has a negative connotation with it. So a multimodal approach means you're probably not just going to find one magic bullet that's going to treat your pain. So we're going to try many different modalities to try and get on top of your pain.
And I think accepting the fact that not everything works for everybody, and certainly the relief is not going to be complete, so you find a concoction of a bunch of different things that work for you and kind of go from there.
Yeah, exactly. Okay, so what are some of these treatments that we can use?
So the first thing I think we like to talk about is activity modification and physiotherapy. So when we talk about activity modification, we tell people, hey, someone comes to me and says, it really hurts when I do this, doc. I tell them, hey, don't do that then.
That's brilliant.
Yeah.
Did you learn that in medical school?
Yeah, medical school, Canadian medical school. So common sense says if it hurts to run, or if it hurts to go up and down a lot of stairs, or to kneel or squat, do what you can to avoid that, accepting the fact that there are certain things in your regular activities of daily living as well as your job that may prevent you from totally limiting them, so you just do your best to change what you do.
Yeah. Activity modification is something that's easy to say, but sometimes very hard to do. But certainly modify the activities that you can. And kind of along the same lines of activity modification is weight loss. If you are carrying a bit of extra weight, that will likely make your hip pain worse if you have some hip arthritis. So weight loss, which is again super easy to say, but definitely can help with your symptoms.
Yeah, and you can refer to one of our weight loss videos where we can provide you with some suggestions of ways to tackle that problem, which is definitely, like Paul said, very difficult challenge.
What about smoking?
I don't smoke, Paul.
Okay. Oh. No, I meant like right now. Do you mind if we take a break?
Yeah. So in general, I tell people that for the obvious physical benefits of quitting smoking, I think it's beneficial. Again, like weight loss, very hard to do. Often requires multiple strategies and implementing other people. But quitting smoking is going to improve your physical fitness and improve things like wound healing and other things. So yeah, in general, I advise them to.
Yeah, I agree. So I mean, it may not, the act of quitting smoking itself, stop your hip pain, but definitely it will enable you to use other treatment options that you may not have been able to use if you're a heavy smoker. For example, down the road, if you're going to get a hip replacement, certainly quitting smoking before that would decrease your risks of an adverse event significantly.
What are your thoughts on physiotherapy, Paul, for hips?
Physiotherapy, that I do try that with people. I prescribe that for anyone who comes in with hip arthritis if they haven't tried it already. It works for some people, it works great for some people, it doesn't work for others, but I definitely think it's a low-risk treatment that's worth trying. What do you think?
I tell them the same thing. The muscles on the side of your hip called your abductors are the ones that help reduce you from having a limp, so if you can strengthen these, often it'll reduce your pain, as well as is a great way to lead into a hip replacement as like a type of prehab. So I tell them to give it a try. If it, for whatever reason, aggravates their hip pain more, I tell them to use common sense and to back off a bit.
Okay, good. So we've covered things like activity modification, weight loss, quitting smoking if you smoke, physiotherapy. What about some pharmacologic treatments? So some pills that you might want to take if you have pain in your hip from arthritis.
So usually I start with things like acetaminophen. I think acetaminophen is very safe. Often it's not quite as effective as non-steroidal anti-inflammatories, but that would probably be my next class of drugs that I talk about, either over the counter or prescription. I think they have significant benefit to reduce the inflammation in your hip. but I also tell my patients that every pill certainly carries with it some risk, such as gastrointestinal risks, or risk to your kidneys or to your heart. So they have to be aware of that and typically discuss that with their family doctor.
Right, okay, so acetaminophen, anti-inflammatories, and there are some newer classes of anti-inflammatories called COX-2 inhibitors that are a little more protective for the stomach because anti-inflammatories can upset your stomach. And then there's another class of painkillers, narcotics. What are your thoughts on using narcotics to manage arthritic hip pain?
I certainly discourage it and almost exclusively preserve use of narcotics for post-operative pain control. There's some good studies that show that if you're taking a lot of narcotics before surgery, it makes it harder afterwards. So I try to avoid it. Unfortunately, some people do get to the point where they just cannot manage. So again, I typically would leave that with the family physician, but try to avoid it.
Yeah, I agree. So narcotics would be things like codeine, Demerol, morphine. I generally keep those for use in the post-operative period to help manage surgical pain that you know is only going to be there for a while. So I'm not a big fan of using it for chronic management of pain. However, you know, there are some chronic pain physicians that do advocate the use of narcotics for chronic pain as well, and in those settings it probably works. However, in the setting of an arthritic hip, I would definitely try and avoid it as well.
Now, Paul, I see a lot of ads in the newspaper and in magazines and on TV about all these creams and lotions and potions. What are your thoughts on the topicals for hip arthritis?
I do use that as part of my multimodal approach. I think a topical cream with an anti-inflammatory property or some other pain management properties can be beneficial, and certainly I've seen that in my practice. I've used topical treatments with some success as part of a multimodal approach.
Yeah, I would agree. What I love about it is that its safety profile is so much better. You're not going to get an ulcer typically from rubbing something on your hip, so the safety side is excellent, and if there's a potential benefit, I think it's a great choice.
Sure, the risks with the topical, probably the most common thing would be a rash or something like that, and then you usually just discontinue use and that goes away. Okay, so we've covered quite a few things. We've covered active modification, anti-inflammatories, acetaminophen, physiotherapy, topical treatments, weight loss, smoking cessation. What else?
Needles.
Okay.
People are afraid of needles.
I'm afraid of needles.
Are you a proponent of injecting the hip to try to reduce pain from arthritis in the hip?
I personally don't use that in my practice right now for a few reasons. One, it's not easy to inject the hip. I can inject the knee readily in the office, and I'm pretty confident that I've gotten the needle into the knee. However, when you're injecting the hip, generally you need some sort of image guidance, so ultrasound or a CT guidance, in order to get the needle into the hip. So for that reason, I'm not a big fan of it. But I have patients who do have come to me and said, I've had my hip injected and it did help. What are your thoughts?
I would totally agree. I think it's difficult to do, so it's labor intensive. Sometimes you get fluoroscopy, so we have to send it to our hospital where one of the radiologists would do it under an active x-ray. So that's one of the reasons I'm not a huge fan, as well as in the times that I have done it, I feel that it's not quite as effective as injecting the knee. So typically I try to manage my hip arthritis non-operatively in other ways for as long as I can until they need surgery.
And the other thing to mention about needles is whenever you breach the skin, like with a needle, for example, there's a risk of infection. The risk of infection is very, very low when you're injecting a knee, and it's very low when you're injecting a hip, but I think it's a little bit higher injecting a hip because the area that you're injecting through it's not as easy to get that area sterile.
Right, the groin's a little dirtier.
Yeah, than the knee. And then there was some evidence that I've seen in the literature that shows that if you do it, you could introduce bacteria there, so that ultimately when you do have your hip replacement, you might have a higher risk of infection down the road.
Which certainly is a bad problem. On that line, though, if you were going to inject it, there's probably two main things that we would consider injecting. One of them would be a hyaluronic acid product, and the other one would be a corticosteroid.
Yeah.
What are your thoughts on either of those?
Well, I think they're both different classes, and they both work in a different mechanism. We go into a little bit more detail about those differences in our knee arthritis video, but certainly a corticosteroid like a Depo-Medrol injection is aimed at reducing inflammation, whereas viscosupplement injection, so like a hyaluronic acid injection, is more thought of like a lubrication for the joint, generally.
I'd agree with that.
Okay, so I think we've covered just about everything that I can think of for managing hip arthritis without a total hip replacement. Certainly look at our total hip replacement video if that's something that you are thinking about. And thanks again for tuning in.
And obviously, if you have any questions, please feel free to send your emails to talkingwithdocs@gmail.com or visiting our website.
And remember, you are in charge of your own health.
See you next time.